Hello, everyone.
Hi, everyone. My name is Kristin Burns. Thank you so much for taking the time today to view this webinar that we are hosting. Um, just to kind of tell you a little bit about my background, my name is Kristin Burns. I am the Director of Nursing at OneWell. I got my start in nursing almost 20 years ago. I started as a pediatric nurse at the Children's Hospital of Philadelphia. I worked there for almost 18 years, and then I made the switch to come to in-home nursing and working with OneWell for the past year and a half. So thank you very much for taking your time today and to listen about the presentation I'm going to be giving about in-home nursing for individuals with IDD. So the objectives of my presentation is I'm going to be talking about the whole spectrum of care that we provide for our individuals with IDD in the home and the benefits of that. Also, how we design our patient care models according to the individual nature of the patients and individuals that we are providing nursing services towards. Also, the challenges and complexities that occur in the home environment. And how we can work through those challenges to make a best supported nursing care environment for that individual. Also, I'm going to be, talking about, how home care nursing can prevent hospital readmissions and keeping our individual at home, which is the environment that they feel the most secure in. And then I will be presenting a case study of an individual that we supported. And then also at the very end of the presentation, we'll have time for some questions and answers. So to begin, it's a large spectrum of care. Nursing encompasses many different components. And the individuals that we serve, they also have a myriad of diagnoses and complexities that we are serving and incorporating into our care plans. So many of our individuals with IDD, they have diagnoses that include autism, Down syndrome, cerebral palsy, and seizure disorders. And these diagnoses impact their cognitive skills, their physical abilities, and also their behavioral functionings. With in-home nursing, we are bringing skilled care. Our nurses are doing, daily assessments of our individuals. They are incorporating medication routines and treatments into the individual's home to support their baseline health and independence in a setting where our individuals thrive the most. And what makes private duty nursing a little bit different than in-home nursing, it just kind of sets the bar a little bit higher, is it provides the personalized, continuous one-on-one medical attention. It reduces hospital readmissions, it lowers costs, minimizes infection exposure, and provides emotional peace of mind for the individuals, but also for the family and caregivers. So designing a patient-centered clinical protocol, has its is tricky sometimes. We can't really apply the one size fits all model, which sometimes you will receive in a hospital setting or in a long-term care setting. That our individuals are in their home. They have unique living situations. So we need to encompass those different scenarios into our our plan of care. And that is what is going to promote independence and safety with our individuals, which is our ultimate goal when caring for these individuals. So our standard clinical care assumes a uniform environment, usually in the hospital settings. You have one unit, you have certain protocols within the hospital, but in the home, that varies from time to time. So with home care, we provide protocols and standards that are custom built around the unique architecture of the patient's home. In this setting, the nurse operates with clinical autonomy. He or she is, working usually one-on-one with the individual. They are using their critical thinking skills, their detailed assessments, and adapting care plans in real time to assess chronic situations or if a new diagnosis or situation may arise. Um, and then ultimately, as I said before, our individualized care is directly preserving independence while enhancing safety in the most comfortable, familiar environment possible for our individuals. We want to keep our individuals home. That is the environment where they feel the most safe and most secure, and we want to increase their well-being and promote their independence. However, there are some complexities that come in the home environment. There are certain things that we need to consider. There's complex needs management that our individuals may have. So many of our individuals have complex diagnoses. They can have overlapping equipments. Some of our individuals may be reliant on a trach, an ventilation system. They may need G tubes in order to support their nutrition needs. They have complex medication regimens. They would have seizure protocols. So all of these are, we are taking from, a plan that was probably implemented in the hospital and adapting that into their home. And then there's variability in the home environment, as you know. There could be unpredictable situations. It could be uncontrolled residential spaces. Unlike a hospital or a long-term care facility where they have a facilities department or they have environmental science, environmental services that can come in and make sure that, everything is tidy and clean and sterile. We're in someone's home and we need to work around those situations and promote those boundaries and keep our safeguards in place in order to preserve infection processes and to help mitigate that as well. So there's a fine balance when it comes to that. And then, we also are adapting strict clinical standards to, unpredictable and uncontrolled residential spaces. Sometimes, you have to factor what makes a person comfortable in their home. You have pets that are in the home, and sometimes there could be unusual pets that are there. So it's all about adapting and making sure that our individuals are safe and are getting the care that they need. And then ultimately, we want to balance the safety and independence of our individuals. Sometimes working in the home, there could be constant friction between protecting our vulnerable individuals from harm while actively promoting their autonomy and quality of life. But even with its challenges, home-based care offers something very unique, and that is human connection. Many times, most home care nurses can build long-term relationships with their individuals. They can support independence in their daily life. And they're providing care in the most comfortable setting with our individuals. These factors contribute to a stronger sense of purpose compared to, other clinical environments. And access to structured personal centered home care services can also support long-term independence and quality of life that we have seen. So there are different types of models that we can use in the home care setting. They have the intermittent care model, which is, a nurse may come into the home maybe a couple times a week or a couple times a month. And then you have private duty nursing, which is the nurse is coming on a more day-to-day type basis. And it can vary of what individuals qualify for what type of care model. For the intermittent care, the monitoring is more reactive response to health events that are happening. A lot of times our individuals are a little bit more independent, are more capable of taking meds on their own and navigating their medical equipment independently. Their environment, there could be, fragmented clinical settings. Also the family role, a lot of times with the intermittent care, caregivers may be a little bit more stressed out or burned out because, the brunt of the caregiving is falling on them. And then also the outcomes of intermittent care because of, you're mostly working on a reactive type model is higher emergency department utilization, and escalation in medical management. And also, there could be some more behavioral escalations as well. So for private duty nursing, since you have the nurse that's coming into the home more often and more on a continual basis, there are proactive early recognitions of subtle clinical changes that can happen. So the nurse gets to know the individual, gets to know those early signs of something is developing, whether it's a medical condition or a behavioral change. As you know, with seasons that change, there are different, things that could be bothering the individual. Right now we're in spring, so everything is blooming and allergies are going to be on the forefront with a lot of our individuals. So a lot of our nurses are keeping that in mind and knowing, what preventative measures can we do to prevent a possible asthma attack or, another crisis from happening for our individuals. And then with the environment, there's a collaboration in our plan of care that we can integrate medical and behavioral supports at home to keep the individual in their routines and keep them active within the community, which brings them happiness and promotes their quality of life. Also, with private duty nursing, our families feel more supported and they act more as a partner with our nurses as opposed to someone who is being a caregiver to their loved one. They can support the nurse with ideas and collaborate with them on, what they can do to enhance that individual's well-being. Outcomes, there's what we've seen in private duty nursing are more stabilized baselines, fewer escalations in care, and ultimately reduce hospitalizations and keeping our individual at home. So this is just a nice little graph chart of how, with private duty nursing, the nurse is supporting the patient's baseline and gets to know that patient. And then if there are some changes that may happen, they can pinpoint those changes and intervene early by calling their primary care doctor or their specialist to report, maybe an increase of seizures or an increase of another, congestion if it's something that, there could be something brewing in, for allergies like at this time of year. There is that consistency of one-to-one care, which allows nurses to identify the subtle clinical and behavioral changes before it can even escalate into a crisis, which is ultimately what we are trying to avoid. So this is a case study of a patient that we took care of. So it was a young adult in his early 20s. He was enrolled in a waiver service. He was living at home with his family. He was diagnosed with intellectual disability. He had autism spectrum disorder, also a seizure disorder. His communication skills were limited. He relied heavily on gestures, routines. So he was, really needed to kind of understand his communication in a different type of way. And his medical needs, he had a G-tube for his nutrition and hydration status. He had a complex medication administration and regimen and dedicated behavioral supports and plans. So prior to our OneWell coming in and providing private duty nursing, this individual was seeing frequent ED visits, more seizures, feeding intolerances. There was inconsistencies with this care and, more behavioral escalations. The family was feeling more stressed out, more of that caregiver burnout. So with incorporating private duty nursing and having one of our OneWell nurses come and support this family, he was able to get on a more stricter G-tube scheduling. The nurse was looking at his position, monitoring to see if there was any complications with his feeding regimen, looking at his G-tube, supporting that, making sure, it was properly functioning. Monitoring his seizures, making sure that, are there certain triggers that are, kind of triggering a seizure activity from happening and what they can do to hopefully reduce that. And then also they were getting consistent one-to-one coverage and reinforcement of daily routines. So the individual was able to mold into a nice routine with this nurse and build a rapport with the nurse. And it just made it easier for the family as well, that they could trust this nurse that was coming into their home, that knew that they were able to provide nursing care for their loved one without them always being the constant caregiver. There was professional medication management and collaborations with therapists and physicians. Ultimately, the stabilized outcomes, the individual had improved feeding tolerance, the nutritional status was improved, and there were a marked reduction of hospitalizations. Also, with the daily routine, the individual had fewer behavioral escalations. They know what to expect. When the nurse came in, they knew what the plan was. And they were able to hopefully control those behavioral crises that could happen in a more volatile, unpredicted environment. Also, the family, had a reduction of stress, and they felt that their loved one was, ultimately feeling more independent, and then that they were in a collaboration with the nurse as opposed to just being the only advocate for their loved one. So it kind of, so in-home community nursing is kind of like this, as you see in this red, this triad of stability. So you have this circle of medical precision of which the nurse is managing. They're managing the medical equipment, the G tubes, the complex medication regimens, detailed seizure tracking with their assessments and documentation. And then you have this other circle, which is the behavioral component. They are working with, building one-to-one trust, emotional support with the individual, reinforcing daily routines and preventing escalations. Also, they're also, incorporating the family as part of empowerment, not just as we need to get this done type of thing. So in transitioning families from being an exhausted primary caregiver who day in and day out is constantly meeting the needs of that individual as opposed to being a partner and collaborating with ideas with the nurse on how they can enhance that individual's well-being. So they're building together a culture of joy in the home health care. They're creating a positive work environment. It's really not, in order for it to be a success, and essential for our care systems, you need to have a positive work environment and collaboration with the families. As a healthcare provider, it's very important for us to prioritize nurse well-being, open communication with our nurses through supervisory support, operational support, and then you can see the improvements in both staff satisfaction and patient outcomes with this type of model. And then this was kind of just like a really nice quote that I saw that I liked, and it just, really kind of wraps up, what private duty nursing is providing to our individuals. It fundamentally changes the paradigm of IDD care. It integrates medical precision and behavioral support in real time within the home, and we can do more than reduce emergency room visits. We're creating a sustainable architecture where individuals and families can truly thrive in the home. So I just thought this was kind of like a nice way to wrap up all the benefits of how in-home nursing can support these goals that we are trying to implement for our individuals. So I appreciate your time and attention to my presentation. These are, if you have any questions or you want to, that you have outside of our Q&A session, you can always look at these resources. This is our information line and our website to get more information about private duty nursing for your individuals, and also an email address that you can reach out and get more information about. So that's all I have. If anyone has any questions, I'll be happy to answer them at this time.
Thank you, Kristin. And maybe we can wait a couple times for the questions. You
Sure.
can use our Q&A session site. You can see the up on the Teams, or you can add your comments or questions our chat. But also, thank you everyone for joining us today. We hope this session provide valuable insight into how in-home nursing support individuals with IDD, as well as the benefits of private duty nursing and the importance of patient-centered and individuals care. A special thank you to Kristin Burns for sharing her expertise and insights with us. And also, if you have any additional questions, you can reach out us. You can use info@onewell.org email, and don't forget to follow our OneWell Healthcare social media to stay update on future webinars and resource and everything. I think there's no question right now.
Okay. All right. Well, thank you all very much for your time. And if you think of any questions outside this, feel free to reach out to the email and contact information that was listed above.
Yeah. Thank you so much, everyone.
Thank you. Thank you for joining. Enjoy this beautiful day. All right. Take care. Bye-bye.